Major depressive disorder, clinical depression. Think of your mind as a bright room where suddenly someone dims all the lights. Major depression is like that, a persistent darkness that affects every corner of your life. It's not just feeling sad, it's like wearing heavy invisible armor that makes every movement, every thought, every interaction require enormous effort. The weight becomes so familiar that you forget what it feels like to move freely. What makes this type unique is its ability to fundamentally alter how you experience life. Simple pleasures, the taste of your favorite food, the warmth of sunshine, the comfort of friendship become muted or disappear entirely. Your brain's chemical balance shifts, affecting serotonin and dopamine, the happiness messengers in your brain, making it physically difficult to feel joy. It's like trying to tune a radio to your favorite station, but only getting static, no matter how hard you try. The most misunderstood aspect is that it's not a choice or a sign of weakness. Just as diabetes affects insulin, major depression affects the brain's ability to process emotions and maintain normal function. It can last weeks, months, or years, creating a new normal that feels inescapable. The condition often manifests physically too, causing changes in sleep patterns, appetite, and energy levels. Some people experience it as constant fatigue, as if their body is moving through thick mud. Others feel restless yet unable to channel their energy productively. The impact on cognitive function can be profound, affecting memory, concentration, and decision-making abilities. It's like trying to solve a complex puzzle while wearing foggy glasses. Everything becomes more difficult, more confusing, and more exhausting. Persistent depressive disorder, dysthymia. Imagine living life with a constant gray filter, not dark enough to block out all light, but enough to mute every color. Dysthymia is like carrying a constant, low-grade fever of sadness. It's less intense than major depression but more chronic, often lasting 2 years or more. The persistent nature of this condition creates a unique challenge. It becomes so normalized that people often forget they're experiencing depression at all. What makes dysthymia particularly challenging is its persistence. It becomes so woven into daily life that many people forget what it feels like to not be depressed. It's like background music that's played so long you've forgotten it's there, yet it influences everything you do. The chronic nature of dysthymia often leads to a gradual erosion of self-esteem and hope, like water slowly wearing away at a stone. The insidious nature of dysthymia lies in its ability to become part of one's identity. People often say, "I'm just a negative person," or "this is just who I am," not realizing they're experiencing a treatable condition. It's like wearing slightly uncomfortable shoes for years. You get used to the discomfort, but it affects every step you take. This type of depression often starts early in life, sometimes in childhood or adolescence, making it particularly difficult to recognize as an illness rather than a personality trait. The long-term impact can affect everything from career choices to relationships, as people unconsciously adjust their lives around their persistent low mood, limiting their potential and opportunities without realizing it.
Click subscribe to this channel to get more topics you love.
Bipolar depression. Bipolar depression is like being on an emotional roller coaster where you don't control the ride. Unlike regular depression, it's part of a larger cycle that includes periods of extreme highs mania and crushing lows. Imagine your emotions as a pendulum that swings between two extreme states, but the depressive phase feels like being trapped in the depths of an emotional ocean with no clear way to the surface. The depressive phase of bipolar disorder is particularly complex because it exists in the shadow of mania. After experiencing the high energy, creativity, and euphoria of mania, the descent into depression feels even more devastating. It's like falling from a great height into a deep ocean of sadness. The contrast between these states can be psychologically jarring, like experiencing both summer and winter in the span of weeks or months. What makes this type unique is the constant awareness that another phase could begin at any time. This anticipation creates a different kind of anxiety and uncertainty. People often describe it as living between two worlds, never quite sure which version of themselves will emerge next. The unpredictability affects not just the person experiencing it, but also their relationships, work, and long-term plans. During the depressive phase, there's often a haunting awareness of the person they were during mania, energetic, confident, and capable, which makes the current state of helplessness and despair even more difficult to bear. This self-awareness can lead to deeper feelings of guilt and shame, creating a complex emotional landscape that's different from other forms of depression. Seasonal affective disorder, SAD. SAD is like being a solar-powered device in a world that loses its sun. As seasons change and daylight diminishes, your internal energy source weakens. This isn't just about feeling gloomy on dark days, it's a profound biological response to changes in light exposure that affects your brain's chemistry. The condition usually begins in fall, winter, and lifts during spring and summer, creating a predictable annual cycle. The fascinating aspect of SAD is its predictable pattern. Like ancient humans who followed natural rhythms, our bodies still respond deeply to seasonal changes. The reduced sunlight disrupts our circadian rhythms, decreases serotonin production, and alters melatonin levels, creating a perfect storm of biological factors that trigger depression. It's as if your body is trying to hibernate, but modern life doesn't allow for this natural slowing down. The experience is like being a bear who can't fully hibernate. Your body and mind want to slow down and withdraw, but modern life demands you keep functioning at full capacity. This creates a unique struggle between biological programming and social expectations. People with SAD often experience intense carbohydrate cravings, excessive sleep, and a heavy feeling in their limbs, almost as if their body is trying to conserve energy for a winter that, in our modern world, doesn't require hibernation. The predictability of SAD can be both a blessing and a curse. Knowing it will end can provide hope, but anticipating its return each year can create anxiety and dread. Postpartum depression. Postpartum depression is like being given a beautiful gift, but finding yourself unable to unwrap it. During what's supposed to be a joyous time, some new mothers find themselves trapped in a fog of sadness, guilt, and disconnection. It's a complex interplay of hormonal changes, physical recovery, and the enormous life adjustment of becoming a parent. The rapid drop in hormones like estrogen and progesterone, combined with the physical exhaustion of childbirth, and new parenthood creates a perfect storm of vulnerability. The cruel irony of postpartum depression lies in its timing. Just when a mother needs to be most present and connected, the condition creates an invisible wall between her and her baby. It's like having your emotional radio tuned to a static channel when you desperately want to hear the music of motherhood. The natural bonding process can feel disrupted, leading to intense feelings of guilt and inadequacy. Mothers often report feeling like they're watching themselves from outside their bodies, going through the motions of caregiving without feeling the emotional connection they expected. But society's expectations of maternal bliss make this form of depression particularly challenging. Many mothers suffer in silence, ashamed to admit their struggles during what's supposed to be the happiest time of their lives. It's like being the only person in a room who can't see the colors everyone else is celebrating. The contrast between the expected joy and the experienced reality can deepen the sense of isolation and self-blame. This condition can affect not just the mother's well-being but the entire family dynamic, creating ripples that can impact the child's early development and the partner's emotional state as well. Psychotic depression. Psychotic depression is like being trapped in a nightmare while awake. It combines the heavy weight of severe depression with a break from reality, creating a uniquely terrifying experience. Imagine your deepest fears and darkest thoughts not just affecting your mood, but actually seeming to come alive around you. Unlike other forms of depression where there's still a tether to reality, psychotic depression creates its own terrifying alternate reality. What sets this type apart is how it distorts reality. Unlike regular depression, which affects how you feel about real situations, psychotic depression creates its own reality. Delusions and hallucinations often reflect themes of guilt, worthlessness, or punishment, making the experience particularly torturous. It's like having your depression gain a voice and vision of its own. The psychotic features often align with the depressive themes, for instance, hearing voices that confirm one's worst fears about themselves, or seeing visions that reinforce feelings of guilt or worthlessness. The severity of this condition lies in its dual nature: the emotional pain of depression, combined with the loss of ability to trust one's own perceptions. It's like being lost in a house of mirrors where every reflection shows your worst fears and self-judgments as truth. The combination of depressive and psychotic symptoms can make treatment more complex, as both aspects need to be addressed simultaneously. This form of depression often requires immediate medical attention, as it can pose serious risks to the person's safety. Yet the very nature of the condition might make the person resistant to seeking help due to paranoia or distrust. Situational depression adjustment disorder with depressed mood. Situational depression is like experiencing an emotional earthquake after a major life change or loss. Unlike other forms of depression that might appear without a clear trigger, this type is directly linked to specific life events such as divorce, job loss, serious illness, or relocation. It's your mind's way of processing and adjusting to significant changes, but the adjustment becomes stuck in a negative pattern. The unique aspect of this type is its clear connection to external circumstances. While the triggering event might be something that others could handle without developing depression, for some people, the emotional impact creates a cascade effect that overwhelms their usual coping mechanisms. It's like having your emotional shock absorbers fail after hitting a particularly rough patch in the road. The depression develops within 3 months of the stressful event and can last for several months. What makes situational depression distinct is its potential for resolution once the person either adapts to the change or the situation improves. However, this doesn't make it any less real or painful while it's happening. The challenge lies in preventing it from evolving into a more chronic form of depression, as prolonged stress can create lasting changes in brain chemistry and thought patterns. It's crucial to understand that while the trigger is external, the internal experience is very real and deserves attention and treatment. Atypical depression. Atypical depression is like having a mood that responds to the environment like a sensitive plant. It can temporarily brighten in response to positive events, but returns to its low baseline when the stimulus ends. This type is unique because, unlike melancholic depression, people with atypical depression can experience momentary improvements in mood in response to good news or positive events, a characteristic known as mood reactivity. The condition comes with distinctive features that set it apart from other forms of depression. People often experience increased appetite rather than decreased, hypersomnia, oversleeping instead of insomnia, and a heavy, leaden feeling in the arms and legs. It's like wearing a weighted suit that gets heavier or lighter depending on external circumstances, but never fully comes off. There's also often an intense sensitivity to rejection, which can significantly impact relationships and social interactions. The term atypical is somewhat misleading because this form of depression is actually quite common. The name comes from the fact that it differs from what was originally considered typical depression when it was first identified. Understanding this type is crucial because it often responds better to certain treatments than others, particularly to monoamine oxidase inhibitors and SRIs. The ability to experience temporary mood lifts can sometimes mask the severity of the condition, making it harder for others to understand the depth of the struggle. Treatment-resistant depression. Treatment-resistant depression is like being stuck in a fortress where the usual keys don't unlock the doors. This type occurs when standard treatments, typically 2 or more antidepressant medications and therapy, fail to provide significant relief. Imagine fighting a battle where your traditional weapons seem ineffective, forcing you to seek increasingly innovative strategies. It affects roughly 1/3 of people with major depression, creating a particularly challenging journey toward recovery. The psychological impact of treatment resistance can be especially devastating. Each failed treatment attempt can chip away at hope, making it harder to maintain motivation for trying new approaches. It's like climbing a mountain where each seemingly promising path leads to another steep incline. The condition often requires a multifaceted approach, potentially including combinations of medications, different types of therapy, and alternative treatments like transcranial magnetic stimulation (TMS) or ketamine therapy. What makes this type particularly challenging is its impact on both patient and healthcare provider morale. The continuous cycle of trial and error can be exhausting, and the financial burden of trying multiple treatments adds another layer of stress. However, it's crucial to understand that treatment-resistant doesn't mean untreatable. Many people eventually find relief through persistent exploration of treatment combinations, novel therapies, or experimental approaches. It's like having to create a unique key for a complex lock. It takes more time and effort, but solutions exist. Premenstrual dysphoric disorder (PMDD). PMDD is like experiencing an emotional hurricane that arrives with clockwork precision each month. While many people experience premenstrual symptoms, PMDD is a severe form that significantly disrupts daily life. It's a complex interaction between hormonal changes and brain chemistry that creates intense mood changes, physical symptoms, and psychological distress in the week or two before menstruation. The cyclical nature of PMDD creates a unique challenge. The predictability of its arrival can lead to anticipatory anxiety, yet the severity of symptoms can still feel overwhelming each time. Imagine knowing a storm is coming but being unable to fully prepare for its impact. The symptoms can include severe depression, anxiety, irritability, and mood swings that are markedly different from one's usual emotional state. The contrast between normal weeks and PMDD weeks can be stark, leading to difficulties in maintaining consistent relationships and work performance. The most misunderstood aspect of PMDD is its severity. It's not just bad PMS, but a serious condition that can be debilitating. The hormonal component makes treatment complex, often requiring a combination of approaches including hormonal interventions, antidepressants, and lifestyle modifications. The monthly cycle of symptoms and relief can create a rollercoaster effect on one's life, relationships, and self-image, making long-term planning and stability challenging. However, understanding its biological basis can help remove stigma and encourage proper treatment seeking. Melancholic depression. Melancholic depression is like being frozen in emotional winter, where even the warmest external circumstances can't thaw the internal ice. This classical form of depression is characterized by profound despair, complete loss of pleasure in all or almost all activities, anhedonia, and significant physical symptoms. It's as if the color has been drained from the world, leaving only shades of gray. What distinguishes melancholic depression is its severe impact on biological functions. People typically experience early morning awakening, significant weight loss, and marked psychomotor changes, either retardation, moving and thinking very slowly, or agitation, restless, unable to sit still. The morning hours are often the worst, with mood and energy improving slightly as the day progresses. It's like being trapped in the coldest part of night, waiting for a dawn that brings only minimal warmth. This type of depression is considered one of the most biological in nature, often responding better to medication than to psychotherapy alone. The complete loss of pleasure sets it apart from other forms of depression, where some enjoyment might still be possible. Even activities or relationships that once brought joy become empty experiences, creating a profound sense of disconnection from life itself. The physical symptoms are as prominent as the psychological ones, highlighting the deep connection between mind and body in this condition. Double depression. Double depression occurs when persistent depressive disorder DYSTHYMIA is overlaid with episodes of major depression, creating a particularly complex and challenging condition. It's like living in constant twilight that periodically descends into complete darkness. The long-term nature of dysthymia, combined with acute episodes of major depression, creates a unique pattern of suffering that can be especially difficult to treat. The challenge with double depression lies in its layered nature. The chronic mild depression becomes so familiar that it feels like a personality trait rather than an illness, while the episodes of major depression feel like falling into an even deeper pit from an already low baseline. This can make it difficult for individuals to recognize when they need to seek help, as they may have normalized their chronic low mood and only recognize the major depressive episodes as problematic. Treatment becomes complicated because it needs to address both the long-term dysthymic symptoms and the acute major depressive episodes. It's like trying to treat both a chronic condition and its acute flare-ups simultaneously. The risk of recurrence is also higher with double depression, making long-term maintenance treatment crucial. The condition often requires a comprehensive approach combining medication, therapy, and lifestyle changes with a focus on both immediate symptom relief and long-term resilience building.